Hi, day 34, or about 5 weeks. Just thought I'd give a quick update. It's been a number of days since my last update. Things with my neck, pain-wise, it's been fairly constant. There's been some days with some aching, like today, and I'm just on a couple regular strength acetaminophen or Tylenol. Other days with pretty much no pain. But as far as the shoulder pain goes, that's totally gone. Scar, no pain at all. And the neck, just an occasional ache. Other than that, as far as improvements, there are unfortunately no changes there as well, but that still might come in the coming weeks or months, or just maybe what I have now is what I'll be living with as well, and that's fine too. I thought I'd spend some time just giving some tips, or rather some things that have helped me, who knows, might help you as well, and in particular about shaving. So the routine for me is when I'm in the shower, I'm wearing the collar. This is an Aspen collar, so there's plastic in the front, plastic in the back, and the pad itself is foam. There's 3 pieces to the pad that goes all the way around, and it is an open cell foam. What open cell means, it's literally a sponge. It gets soaking wet. There's no way to really dry this off after the shower is finished. So what I've previously done is put down a square mattress pad, and this is just something that protects against water or other fluids from wrecking the bed. So this is on my mattress. After I finish with the shower, dried off as much as possible, I just lie down on the bed with this sponge over top of the mattress pad, and then my wife takes off the old pad, the front, and then the second piece is under the neck. She presses down on the bed to slide it away from my neck all the time. She and I are both focused on just keeping my head and my neck stable. So then my mattress pad, the collar pads are all removed. She'll swap them out and replace them with the second set of pads I have. So I did get a pair of pads, I guess 2 sets of pads. The one set to use, the second set to clean, to dry, and then to use after a shower or bath. So I'm lying down on the bed and collar's being removed. What I do then is shave, and for me it's quite simple, and essentially I just use a blade, and my wife is standing next to me with just an old yogurt container with some hot water in it. So I just occasionally dip this off and I just dry shave. I don't use shaving creams or oils. This is the way I've normally shaved, so it's nothing strange or new for me. I simply hold a mirror with one hand and then just shave. And when I do this, I try not to go over areas multiple times. And the reason being, there's a little bit of redness on my chin. This is something that's been there since pretty much the beginning, when I could take this off and look. And it's something I do not want to irritate. Being clean shaven, it is great. It is something that just adds a great deal of comfort. What I started out doing is made a foolish attempt to grow a beard. I cannot grow a beard, I fully admit that now. In addition to just having it look terrible after 12 days, it itched like crazy. So that was a bad experiment. It did cause a lot of redness. And the redness has reduced since I got rid of it. Now, I didn't know how to get rid of it. When I decided to shave the beard off, this is before I decided to go back to just the mirror and the dry shaving. I purchased an electric razor, which is something I had never used before. I thought, with having to keep my head stable, this is perhaps a better way to go than the blade itself. So I took hair clippers, got rid of all the beard I could, and then used this and found out that this irritated my neck like crazy. And there's a reason I don't use electric razors. I just reminded of that yet again. So after a few days of just letting it kind of relax and cool off again, I went back to the blade. And after I shave, I do not put shaving cream or anything else on. I don't want to have that in the pads pressed up against my neck and causing potential further irritation. So after the shaving is done, wife will just wipe off my neck just to clean it off, and then just replace the pads and the plastic as well, and I'm good to go. A second tip, and this is about brushing teeth, is just having either a small plastic cup or some disposable cups. And these I found quite useful for spitting into, or just getting water, putting it into my mouth, and avoiding getting this, at best case, just wet with water. Worst case is, you're putting spit or toothpaste on this. So disposable cups work quite well. And related to that is eating. Eating some foods can be a bit messy, but you don't want to give them up. There you go. You can have yourself a nice bib. The spouse, the kids, they'll just love it. And it works quite well. I'd really recommend trying something like this as opposed to trying to eat spaghetti and keeping this clean. You just won't do it. Finally, about the scar itself. You can probably see the scar itself is, in my mind, not looking too bad. It's quite visible still, obviously, and it will be for quite some time. As far as trying to minimize this, the two things recommended to me, when I had my whole Aspen collar checked out, I'm not too sure what the person's title is, but the person working there said when the scar was looking good, no gaps, no holes, no inflammation, I could pull the skin out a little bit and just massage every so often to break down the scar tissue. I found that to be very difficult as my neck skin is just very tight, so there's not really much pulling that can be done. And the second thing was talking to a pharmacist, and the pharmacist had recommended Stratoderm Scar Therapy Gel. Now this is just a silicone gel. It creates a silicone coating. I just put that on once a day. And that just protects everything, so it just helps the tissue itself, I think, to stay moist, not really dry out, and over time, I think it's between 60 to 90 days, reduce the scar tissue itself. And the last point is about work. I have talked with the surgical clinic, and they said I do have approximately 2 more months off of work. And that's something that was a bit of a surprise to me when I heard it, a bit disappointed, obviously. But the reason they gave for me was I had a double disectomy and not just a single. And with a double, they've had problems with people going back to work too fast. And the type of work that I do is, like, my head is in a tilted forward position. You can think of just typing, writing, or reading notes. And you're putting too much weight on the neck too soon. And it causes inflammation, and it caused people to go into and just to see the clinic and cause a lot of problems with the recovery. So it's 2 more months approximately. At that point, I'll go and get an X-ray. They'll have a motion check, and they'll determine from the X-ray and the motion check if everything is good, and I can start to wean off of this and go on to physiotherapy. So that's the way it is for me for right now. I'm happy to have as much time as is needed, because you look at recovering from this, you have to look at long term, and you don't want to try something too soon and get into a lot of trouble where just a few more weeks could have perhaps given you a lifetime of just little or no pain. Take care.